Hello everyone. So today we are dealing with the histology of blood vessels. The objectives of my talk are I will be speaking on the general structure of a blood vessels. Then I will be speaking on these three different types of blood vessels. That is the artery, vein, and the capillaries. So I will be classifying all these three structures, and then I will be speaking on its histological features. Basically, the circulatory system, it consists of heart and the blood vessels. As it includes the heart and the blood vessel, it is also called as cardiovascular system. You are aware of this. Now, the blood vessels, they form a closed system of the circulation. So what I mean by closed system of circulation is the blood which is pumped from the heart goes via the artery into the capillaries, come back via the veins into the heart. So this is a closed system of the circulation. This is divided into two types. So the basically the circulation is of two types. That's the pulmonary circulation and the systemic. The systemic circulation is the one where the blood which is pumped from the heart goes into the tissue and come back into the heart again. And the pulmonary circulation is the blood is pumped by the heart, it goes into the lung where it is filtered and come back into the heart again. So these are the two basic types of the circulation what we have already studied. So the basic component regarding the blood vessels what we have to study today are these three: the arteries, capillaries, and the veins. So let us begin with the general structure of a blood vessel. So the blood vessel as a whole, whichever blood vessel I say, as a artery or the vein, they have this three different components. So one is the tunica intima. This is one of the layer called as the tunica intima. It is the inner layer. The middle layer is called as the tunica media, and the outermost layer is called as the tunica adventitia. The tunica intima is lined by a simple squamous epithelium. You are aware that the simple squamous epithelium are the one which lines the vessels. Also, there are present around like in the peritoneum where they are called as a mesothelium, and the lung alveoli where they are lining. So these are the different simple epithelium where they are present. So those simple epithelium which lines the vessels, they are called as a endothelium, and the one which lines the peritoneum is called as mesothelium. Yes. So I was here in the tunica intima. This tunica intima has the lining called as simple squamous epithelium. This simple squamous epithelium, they are generally forming a tight junctions between the respective epithelium. So they form a smooth surface for the lumen of the vessels. So this is one of the function that this smooth surface provide a rapid flow of blood through the vessel. There are a few other functions of this endothelial cells. Apart from providing a smooth surface, they also do the secretions of a few substances like collagen, endothelin. The endothelin is the one which helps in the vasoconstrictor, while the nitric oxide, it is a vasodilator. And you might have heard about von Willebrand factor, which helps in the coagulation of the platelet so as to form a blood clots. Okay. Apart from this, it also has it is a site for the storage of the enzymes like angiotensin converting enzyme. So this angiotensin converting enzyme, they help in the conversion of angiotensin 1 into 2, which is helpful in the blood regulations. So these are the function of endothelial cells. So coming to the tunica media, the tunica media, it consists of in this picture you can see this section is of the artery and this part is of the vein. Basically here you can see the tunica media is thicker in this section. This is of the artery, and the tunica media is thin in this section, which is of the vein. Okay, so basically the tunica media, it consists of the smooth muscles and elastic fibers, few collagen fibers. Depending upon its component, they are classified further as elastic, muscular, elastic artery or the muscular artery. Okay, the tunica adventitia is the outermost coat. They will be having a connective tissue. So this connective tissue are in the form of collagen fibers, elastic fibers, or smooth muscles, and even the cells of the connective tissue. So which are the cells of the connective tissue? They are obviously the fibroblasts, macrophages. So those will be present in the tunica adventitia. If you compare both, this is the artery and this is a vein. If you compare here, you can see the lumen size of the artery and the lumen size of the vein, which is larger. And you can see the wall thickness. The wall thickness of the artery is thick as compared to the wall thickness of the vein, which is thin. If you see the tunica adventitia, it is thin in the artery and it's thicker in the veins, while the tunica media is thicker in the artery and it is thin in the veins. Okay, so grossly, when you have identified the artery and the vein when we are dissecting, you have palpated the artery and the vein. So the one which had the elastic in the nature, what you have diagnosed as it being an artery. So the one which was on pressing, which was collapsing, so you have identified it being a vein. Yes. So the lumen of the veins is generally collapse, and the artery it regains its nature. Okay, so this is how you can differentiate the artery from the vein. Okay, we'll go further into details to know about the features or the histological features of both artery and the vein, and we'll classify each of it. The one which is connecting right in the between here, you can see the capillaries. Okay, further, we'll go into detail about the arteries. So what I said, this is the general plan for each of the vessels, that they have these three layers: tunica intima, media, and adventitia. So whenever you are going to speak on the histological feature of each of these structures, you will be speaking on individually the tunica intima, media, and the adventitia. So let us begin with the histological features of the arteries. So we'll start with the tunica intima. So this is one of the artery, what you can see right here. So this artery, they have the tunica intima, as I said. So the tunica intima, the first layer, what you can see after the lumen is the endothelium. So endothelium is nothing but the simple squamous epithelium, right? So this endothelium, it rests on the basement membrane. Now, at a point in a few books, you may come across the word called as basal lamina. So basal lamina is one of the component of the basal membrane, basement membrane. So the basement membrane, it was divided into the basal lamina and reticular lamina. So that was the electron microscopic features of the basement membrane. This word, basal lamina, may be interchangeably used with the basement membrane in some books. Okay, so the basal lamina, whatever they have explained in the books, it's nothing but the basement membrane. So the endothelium, they rest over the basal lamina, and below the basal lamina lies the subendothelial connective tissue. So in this picture, you can see this is the artery and this is the cut section showing its feature. And the first layer, what I said, is the endothelium, and beneath the endothelium lies subendothelial connective tissue. Subendothelial connective tissue is again a connective tissue which is having the collagen bundles, elastic fibers of the smooth muscles, and macrophages here, or the fibroblasts. And beneath this connective tissue lies the elastic fibers which are forming the internal elastic lamina. The notable feature is that this internal elastic lamina form a demarcation between tunica intima and the media. Here you can see this much layer is a tunica intima and this layer is called as tunica media. So wherever you identify as an internal elastic lamina, it demarcates the intima from the media. Okay. The next layer comes with the tunica media. The Tunica media is next to it, which is composed of smooth muscles or the elastic fibers. Depending upon its constitution, it may be divided as elastic artery and muscular artery. The next to the outermost layer of this tunica media is the internal elastic lamina. It is again the elastic fibers which demarcates the tunica media from the adventitia here, right here. Okay, coming to the tunica adventitia. The outer layer is called as a tunica adventitia, and it consists of again a connective tissue which is having the collagen fibers and the connective tissue cells. Now the point to remember here is this collagen fibers, they are running parallelly. It means along the length of the vessel, while the smooth muscles or the collagen fibers or the elastic fibers which are present in the tunica media, they are concentrically arranged around the vessels. Okay, while the connective tissue or the collagen fibers or any smooth muscles which will be present in the tunica adventitia, they will be running longitudinally. This is a difference which is to be noted. Okay, thus basically we have divided the histological feature of the artery being a tunica intima, media, and the adventitia, and the mark which demarcates the tunica intima from the media is internal elastic lamina, and the one which demarcates media from adventitia is external elastic lamina. Now, the nature of this internal elastic and the external elastic lamina are the elastic fibers. So, do you expect this demarcation in elastic artery? The elastic artery is the one where the tunica media is mainly composed of the elastic fibers. So, can you demarcate the internal elastic lamina and external elastic lamina there? No, you cannot differentiate the internal and external elastic lamina from the tunica media. Okay, so this is the point to be noted. Okay, now let us classify the artery. Now the arteries, they are classified on the based on diameter of the artery, thickness of the wall, and the component of tunica media. When I say the diameter of the artery, I may say the large, medium, and the small. So the artery may be named as large sized artery, medium sized artery, and small sized artery. Depending upon the components of the tunica media, as I explained before, the main components of the tunica media are the elastic fibers and the smooth muscles. When more number of elastic fibers are present, they are called as elastic artery. And when more number of muscular fibers are present, they are called as muscular artery. The smaller vessels, they are also called as arterioles. Okay. Let us go further to the elastic artery. Elastic artery, yes, obviously, they have the more number of elastic fibers in the tunica media. They are also called as conduction artery. Let me tell you why they are called as conduction artery. Because they help in the conduction of a blood from the heart towards the different organs. So, where you expect such, which are the examples of such conduction artery or the elastic artery? They are the one which is coming out from the heart, that's the arch of aorta and the pulmonary trunk. Okay, to what extent you will say at it being the elastic artery? So wherever you will find more number of elastic fibers, you will say as this. So generally it is the arch of aorta, pulmonary trunk, and the branches of it. So what are the branches of aorta? This is brachiocephalic trunk, this is left common carotid, and this one is the left subclavian artery. These three branches of the arch of aorta is considered in the elastic artery. The diameter of the elastic arteries is more than 1 centimeter. The function of the elastic artery is it creates the elastic recoil of the vessels, which helps in the continuous flow of the blood. Let us understand what is the elastic recoil. So this picture depicts the elastic recoil nature of the artery. You know, as the elastic fiber has more number of elastic artery has more number of elastic fibers, they maintain the elasticity, right? So when the heart is in a systolic phase, that is when the heart is pumping a blood, it pumps the blood forcefully through the arteries, which help in the dilatation of the vessels, right? So this dilatation of the vessels create the potential energy within the artery. So when the heart comes into its diastolic phase, the the artery they come back, regain its normal position. So when it is regaining its normal position, it tries to push the blood which is present there. Because of this, the blood is flowing continuously through the artery, and the reason is the elastic recoil. And the elastic recoil is one of the function of the elastic artery. Okay, let us see the microscopic feature of the elastic artery. Again here, three basic things, three walls: tunica, intima, media, and adventitia. This is same. The lining epithelium is a simple squamous epithelium. Next layer is again the same, uh, subendothelial connective tissue, right? After it comes the internal elastic lamina. Now the point to note here is the internal elastic lamina is not clearly seen, but here it's prominently seen. It means this is not the H&E stain. It is a special stain used to depict the elastic fibers. The H&E preparation is this slide, where you cannot identify the internal elastic lamina. You can see the endothelial line, and directly you can see the wavy nature of all the elastic fibers right here, and some a nucleus of smooth muscle cells which are intermingled between them. Okay, so the tunica intima here basically consists of simple squamous epithelium and subendothelium resting on the basement membrane, and below it lies subendothelial connective tissue. Next layer comes the tunica media. The tunica media is the thickest of all these three layers. Now here it's very clear in this picture. You can see this thick nature is the up to here is the tunica media, and it is completely filled with the wavy elastic fibers. These elastic fibers uh, they form sheets, and within these sheets lies the smooth muscles and the collagen fibers. So the predominantly they are having the elastic fibers. Outside outside the tunica media, or the outer coat of it, you may find the external elastic lamina, which is not differentiated. Again, the reason is the elastic nature of the tunica media. Okay, the last layer is the tunica adventitia. The tunica adventitia is relatively thin, and uh, this the tunica adventitia here will be having the connective tissue, and you may find the sections of longitudinal fibers getting the sections of collagen bundles, and at a time you may also find smaller vessels. Right here you can see one of the vessels right here. So those are the vessels which supply the artery. Now why vessels are needed to supply the artery? When you come to a larger vessel, generally the vessel gets its blood supply through the diffusion from the blood which is present in the lumen. So it diffuses. So when the vessels are larger, it cannot diffuse completely to supply the entire wall. So you need a separate blood supply to the artery, which supplies the rest of the wall. So the vasa vasorum are the vessels which supply the vessels, and they are present in the tunica adventitia. So they supply all the layers of the tunica adventitia and the outer part of tunica media. The remaining part gets its supply via the diffusion from the lumen. Okay, so this is all about the elastic artery. Let us move towards the muscular artery. The muscular artery are also called as medium-sized artery, and they have the lumen diameter about 2 to 10 mm. It has predominantly a smooth muscle cell layer, and they are also called as a distributing artery because they regulate a blood flow towards the organs. So when you call such an artery as a muscular artery, when the arteries they are specified to particular organ or particular limb, you may call it as a muscular artery. To give example, you may see the artery towards the lower limb, main artery towards the lower limb. It's a femoral artery, so that's a muscular artery. The artery towards the arm, a brachial artery. Likewise, the artery along the radial and the ulnar. So radial and the ulnar, they are the muscular artery. Or towards the organ, like renal artery towards the kidney, and splenic artery towards the spleen, gastric artery towards the stomach. So those are the muscular arteries. As the tunica media of the muscular artery has a smooth muscles, the contraction of the smooth muscles may alter the size of the lumen, and thus they help in the regulation of a blood. That's why they are also called as a distributing artery. Okay, they distribute the blood towards the organ. Okay, so now till now we have studied the two types of the arteries, the elastic artery and the muscular artery. The elastic artery is also called as and the muscular artery is called as distributing artery. Yes. Let us go into the microscopic features of the muscular artery. The muscular artery, it has the tunica intima, media, and the adventitia. The features in the tunica intima are again the endothelium, subendothelial connective tissue. The prominent feature is the internal elastic lamina, which is wavy. Now, the point to note here is why the internal elastic lamina is prominently seen. The reason is the smooth muscles. The smooth muscles, they create the wavy nature of the internal elastic lamina. See, the tissue what we get procure is from the dead cell, like dead tissue. So after the death, there happens a rigor mortis. So in the rigor mortis, all the muscles they go in a contraction. So when the muscles they get contract, what they do, like when the smooth muscles they contract, they create the wavy nature, or they try to fold the elastic nature of the fibers right there. So is the reason why the elastic fibers in the internal elastic lamina is a wavy. Okay. The next comes the layer of the tunica media. The tunica media has predominantly the smooth muscles, and it is up to the 40 layers of the muscle you can see there. And again here, the external elastic lamina is clearly visible because of the smooth muscle nature of the tunica media, so that the elastic fibers could be differentiated, right? Tunica adventitia is again a connective tissue which is having the collagen fibers and the bundles of smooth muscles which are running longitudinally. This is histological H&E preparation of medium-sized artery or the muscular artery. This wavy nature, what you can see is the internal elastic lamina, and here you can see the smooth muscle cells, and this one is the external elastic lamina, and this one is the tunica adventitia. This is the luminal side of the vessel, and you can see the blood cells within this. These are the RBCs. Okay, let us come towards the smaller artery, which is also called as the arteriole. They are how small? So they have the size less than 100 microns. If you see in this picture, this is the arteriole, this side is a venule, and both have in between the capillaries. The arteriole, they are also called as a resistant vessels. The contraction of this can create a resistance, help in the regulation of a blood pressure. So it's called as a resistant vessels. This may come as an MCQ. The resistant vessels are arterioles. Okay. Let us go into the histological features. Now, Here, the tunica intima is having the endothelial cell layer, subendothelial, and the internal elastic lamina are poorly developed in this. But the tunica media, they may have a smooth muscles around 1 to 3 layers. Why I say as a 1 to 3 layers? Because at a point you may find when it's a larger arteriole, they may have a 3 layer of smooth muscles. Here you may see the layers 1, 2, and the 3. When it comes to the towards the smaller arteriole, there may be only one layer of the smooth muscle cells. The tunica adventitia is thin or the ill-defined. I have one more picture to show you, which shows the three different types of the arterioles, the larger and the smaller one. Here you can see this is a lumen, and here there is one more arteriole, and this is the other one. The endothelial lining and the smooth muscle lining around it. This is a bit smaller than it, and this is the smallest one, the arteriole. The capillaries could be seen by one or two endothelial lining with its extension. So this smaller size capillaries and this one are the arterioles. Let us move towards the capillaries. The capillaries are nothing but a thin-walled endothelial lined microscopic vessels that connect arteriole and the venules. The diameter of this is around 5 to 10 microns. So we know that the RBCs, they have the size of around 7 microns. And what we say, the blood passes from artery towards the vein via the capillaries. So the blood cells has to go via this. So when they are passing via the capillaries, they are forming a sequence in that they go via line and go into the venules. So here in this picture, you can see this is a longitudinal section of the capillaries showing the single lining epithelium, simple squamous epithelium resting on basement membrane and nothing else. No muscular coat surrounding it. So this is the capillary, and you can see the RBCs, they are forming a single line right here. And this is, here you can see the endothelium and the smooth muscle cells surrounding them. So this could be the arteriole. Yes, and you can see the blood cells within them. Okay, so the microscopic feature of the capillary is they have the single endothelial cell layer with the basal lamina. The margins of the cells, they are joined by the tight junctions at a point, or they may be in a discontinuity. I'll tell you those classification further. So generally they are having a tight junctions, right? And the pericytes will be seen surrounding them. The important feature is they do not have tunica media or adventitia like the other blood vessels. So they have only a single endothelial lining which rests on the basement membrane. That's it. Okay. Now let us classify the capillaries. The capillaries, they are classified as continuous capillaries, fenestrated, sinusoidal. Continuous capillaries are the one where the endothelial cells, they form a tight junctions with each other, and they are resting over the basement membrane. Then how the substance passes through it? So they form the pinocytic vesicles, and they pass through a transcytosis route. They pass through the cytoplasm of the cell. Okay, such a capillaries are also called as somatic capillaries. Examples of this are, such a capillaries are present in the muscles, in the connective tissues, skin, or in the lungs. So the continuous capillaries are the one where the endothelial cells are forming the tight junctions. Right. Other type is fenestrated capillaries. Fenestration means openings. There are a few openings within them. So such a pores, this endothelial cells, they have many pores within them, and they help in the diffusion of a substance through them. But this endothelial cells, they will be lying over the basement membrane, which is continuous. throughout the capillaries. So the basement membrane is continuous, and endothelial cells, they have the pores through them. Like this basement membrane, they form a slit-like diaphragm for them, right? And such a capillaries, fenestrated capillaries, are present in viscera generally. So they are present in the intestinal villi, pancreas, and endocrine glands. So they are also called as the visceral capillaries. So somatic capillaries are the continuous capillaries. Fenestrated capillaries are visceral capillaries, where in the intestinal villi, the nutrients has to be absorbed in the small intestine. So which acts where you need the fenestrated capillaries. Sinusoidal. The sinusoidal are the special kind of capillaries which are large and irregular in the shape. Basically, you may see the larger pores. In this picture, you can see the larger pores which are not closed by any diaphragm. It means the basal lamina is also irregular and perforated. Right? Examples of this is liver, spleen, or adrenal medulla. Okay. Let us go to the veins. The veins are classified as large, medium, and the small size vein, as how we have classified the artery. They again have the three layers: intima, media, and the adventitia. Here, the prominent feature is the wall of the vein is relatively thin, and the lumen of the vein is collapsed, not like the artery, which is forming a particular nature, sharp margins. The microscopic feature of the large vein are like tunica intima has the endothelium and the basal lamina, subendothelial connective tissue, and few smooth muscles, and the walls may be present at a point. Okay. The tunica media, you will find it is not as thick as the artery, but here you can see it's a thin layer of the tunica media. So in this picture, you can identify the tunica media only up till this extent. So what you find in the tunica media is the smooth muscles, collagen fibers, and the fibroblast cells. Tunica adventitia is prominently large, and what you expect here are the connective tissue, the collagen bundles, but this collagen bundle, they are running longitudinally, so you may see the sections of this collagen bundles and the smooth muscles which are present here. So these are the sections of it. As it is running longitudinally, if you take the section, you will find it being in the bundles, right? So these are the feature of tunica adventitia, and few vessels you can identify, vasa vasorum. Microscopic feature of a medium-sized vein is as follows. Like tunica, all the three layers are seen. Now this is the artery and this is a vein. So this is a medium-sized artery. So this is medium-sized vein. So medium-sized vein, they have again tunica intima, the same feature like large-sized vein. The tunica media, they have a fewer number of smooth muscle cells and elastic fibers, and the tunica adventitia is typically thicker than the tunica media. That's it. Let us come to the last point, the microscopic feature of the venule. Now they are divided into two types, post-capillary venules and the muscular venules. They are nothing but the smaller venule and larger venule. Muscular one are the larger and the post-capillary are the smaller venules. The smaller venules, they will be having endothelium, basal lamina, and the pericytes, as they are formed by union of 2 or 3 capillaries. While the muscular venules, they are the largest one, and there will be a presence of 1 or 2 layers of the smooth muscle cells outside the tunica intima, and the tunica adventitia is bit thicker. So that's the difference between the two types of venules. At the end, we'll go with the blood supply and the nerve supply of the vessels. Blood supply of the vessel is called as a vasa vasorum. The tunica adventitia and the outer part of tunica media receive its blood supply from vasa vasorum. The remaining part, that's the inner intima, and the remaining part of the media is via the diffusion of the nutrition from the lumen. The nerve supply is autonomic. So it's a sympathetic nerve creates a vasomotor causing constriction of the vessels. Parasympathetic causes vasodilator. Okay. That's all regarding today's topic. Thank you.